Raghothama, and I want to basically take the opportunity to have some conversation, about your career that has been so far, and also about your future, goals of your career, and also what you can foresee in this field. Obviously, you have been in Johns Hopkins, a medical institution for many years, and after that, you work actually in a facility environment, and then you join AstraZeneca and work there for almost 10 years. So you have both academia and industry experience. You have been really pioneering in proteomics in this field, and what you have been experiencing about the major difference between these two, academia and the industry environment, in terms of proteomics applications. Can you talk a little bit about that?
Thank you. I'm very happy to share my experience. I worked in academia in the beginning in Johns Hopkins University, and that gave me opportunity to explore many different things in proteomics. And mainly in academia, we are doing mostly exploratory research. There is no pressure, but you can explore different things and contribute to the research. But actually that experience helped when I moved to the academic to the industry, where research is more focused. It is mostly focused on the pipeline projects. There is not much flexibility, and it is very time bound. If you are not able to successfully use that approach, you have to be flexible to change to a different approach. So that's the main thing, and it's always measured by the end product, whether you are going to work on that project or not. It's mostly success oriented. Whereas in academia, your research can end up in a publication, or it can end up in collaboration, but in industry it has to be on projects in the pipeline. So it's more time bound and well planned.
Okay, so it sounds like in the industry environment, so you have a lot less freedom. You are mainly a part of a loop in the whole chain. So basically, you are providing some of the support of their product rather than freely suggesting what you think is worthy of doing, something like that.
Yeah, that's what I felt during my experience in AstraZeneca. So it's actually not your decision. It's actually you have to consider the whole company goal in mind, and you have to work towards that, and you have to plan your experiments and or the proteomic project in that direction, rather than you may be interested and more creative in your own approaches, but there is no time to develop those things. Actually, borrow technology from the academic or already published literature rather than developing something in-house. So that's another limitation. So you'll be more kind of repeating the same technology to different projects. There's not much creativity, but you are still it gives you more satisfaction if the project ends up in a good drug into a pipeline. But in industry, it takes long time to see that results, because each drug development takes at least 10 years and involves a lot of
sense.
Funding and
Yes, makes sense. So basically, if I understand correctly, in industry environment, you are mainly proteomics is mainly being used as a tool for to provide support to other departments. But in academia environment, it's not only a tool for your research, but also you actually can actively develop something that has a potential to lead to publications and to lead to some patents, in particular in proteomics field. Is that right?
Yeah. Mainly, it gives you you learn a lot of things. You invent new tools, and so that lead to publication and also patent, and also you can also attract industry collaboration. But you are not directly working with the industry or any big company in that sense.
Yes, I understand. So, apart from academia and industry environment, what motivated you to join Complete Omics? Because we are developing molecular diagnostics. We are a biotechnology company rather than a very established academia institution or a very established like AstraZeneca pharmaceutical companies. What triggered you to make the move to join us?
Yeah, actually, in academic as well as industry, I felt some saturation. There is no scope for like a big application of my knowledge. But both these experience helped me to think about my next step, like joining Complete Omics, where it's mainly focusing on bringing this technology from bedside to bedside, and that's where I find like my passion is at that area where I can apply my knowledge and
Yes.
which can be directly developed into a tool for patient diagnosis or prognosis to improve the patient care.
Yes.
Ultimately.
Yes, thank you for the nice comment. That's what we are trying to achieve. We try to leverage all those novel technologies in clinical proteomics space, trying to make the best molecular diagnostic pipeline in the world. So I think it's a great mix. For example, we have been both in academia environment and also you have been in industry for quite long. So you know those advantages and disadvantages of different environment when applying for proteomics technologies. And in Complete Omics, right, I believe that you have been working like quite long already here, and you have been a leader in this clinical platform development. And we are seeing a lot more things than before, which could use that as a tool, and also itself is a great advance in this field, in proteomics field. So what we are doing is like that. And I want to ask you one more question. Is you have been here for like almost a year, and what do you foresee? I mean, can you elaborate about what do you think about the future of the company and where we should go, and what directions are your drives your most excitement, coming from? Yeah.
I think everybody in the field proteomics accept there is potential of applying the proteomics to developing some assays, but so far it's not successful because there is understanding the field is different from accepting that reality and taking that challenge. I think in Complete Omics I felt that the group is taking that challenge. It's possible to make this into a reality. It's a potential technology, but we can make that into a reality. And because of that trust in this company, I realized that it is slowly as we develop the tool, I realized that it's going to be a reality, and we are already seeing the success. So basically why I joined this company is the same reason. There is because you are as a leader taking these things as a challenge, and you have the determination to reach that goal, and I also believe in proteomics because of my experience. So that two things together made me happy to join the company and be successful. And what I foresee is that these developments is going to be finally a very useful, powerful tool in proteomics clinical diagnosis.
Yeah.
That's what I see. In near future, it will be. We can already see a prototype of that working.
Yes.
And that can open into a very new avenue where new things can be added to that, which is patient-specific, where patient needed like a personal
Yes.
medicine. So those possibilities are there. So and we are going to make that happen.
Yes, I appreciate that. And I believe with your expertise and the long-term experience in clinical proteomics field, we will make our platform very, very valuable in these clinical applications of omics, not only proteomics, but also omics fields. And also, I sincerely hope that we can work together to build something that can benefit patient care in terms of diagnostics and companion diagnostics, and more importantly, potentially you can change people's opinion about health screening and people's opinion about going to hospitals. Then I think it's a time to make it happen, and it's time to make proteomics really into clinical, very close to human lives every day. Thank you so much. I believe that we can make it.
Yes.
Thank you.
Thank you.
Thank you.